These are 5 facts about the coronavirus. 1. The disease can make anyone sick. Fear and anxiety about COVID-19 can cause people to avoid or reject others even though they are not at risk for spreading the virus. People often think that the people susceptible to the disease are the elderly and the young due to the fact that their weakened immune system. And although there is truth to this idea, it doesn't mean that the people between their ages are safe from the virus. People often also conclude that race is a major factor in spreading the virus, especially Chinese. Although the virus first started in China, it doesn't mean all Chinese people can spread the disease. 2. The risk of complications from COVID-19 is low. While complications like cytokine release syndrome, septic shock, disseminated intravascular coagulation, venous thromboembolism, secondary infection, acute kidney injury, pancreatic injury, neurologic complications, rhabdomyolysis, pregnancy-related complications have low chances of occurring. There are other serious complications that occur more often than the rest, like acute respiratory distress syndrome or ARDS, acute respiratory failure, cardiovascular complications, acute liver injury, and cytokine release syndrome. And the highest to occur is comorbidity, the simultaneous presence of 2 chronic diseases or conditions in a patient. 3. People who are quarantined does not pose any risk of infection. People who completed quarantine does not pose any risk of infection to other people. This means that the people who have spent the last month isolating themselves and have been placed in quarantine pose no threat to others in terms of spreading the disease. This is because the people in isolation have the lowest chance of contracting the disease than the people who have left the house more often than not. That is why it is very important to isolate ourselves in the given situation to lessen the risk of spreading the disease. 4. Be aware of the symptoms. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate symptoms. Common symptoms are fever, tiredness, dry cough. Some people may experience aches and pains, nasal congestions, runny nose, sore throat, diarrhea. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. People with mild symptoms who are otherwise healthy should self-isolate. Seek medical attention immediately if you or someone you love has emergency warning signs such as trouble breathing, persistent pain or pressure in the chest, new confusion or not able to be woken, bluish lips or face. 5. Simple things to do to keep healthy. Wash your hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing, or sneezing, going to the bathroom, and before eating or preparing food. When in public, wear a cloth face covering that covers your mouth and nose. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Now, don't forget to subscribe to my channel and click the bell icon to be notified of any upcoming videos.